Welcome to Sip of Wellness, the podcast that we dive into the world of healthcare and wellness. Together, we're going to talk about the experts' insights, practical tips, and essential details that will help us live a healthier lifestyle. So grab a drink of your choice, tune in, and let's get started. My name is Sahar, and in today's episode, we're going to be talking about oral hygiene, the process of it, the benefit of it, what we should avoid, what we should not avoid. And today we are having our expert joining us, Angela. How are you doing?
Hello, Sahar. It's a pleasure to be here, and I'm very excited for this podcast.
I'm so happy that you're here, and I'm so happy that we're going to be discussing about the importance of oral hygiene, which is something that is basically, it's a simple chore, but it is part of our life that we should be doing every day. Angela is a knowledge manager at Curaprox, and Curaprox is a leading premium Swiss oral care brand. So, Angela, could you tell us a little bit more about yourself? Give us a little bit of background.
Yes, definitely. As you said, yes, I'm currently an education manager at Curaprox, but I do actually have a dental background. So I am graduated in dental hygiene from the University of Lisbon in Portugal since 2008. So since then, I've been practicing in private practice in Portugal, also in Saudi, and also here in UAE.
Oh, that's amazing.
Yes, thank you. And also I had a chance to work as in a health school back in Portugal. So I always, during my career, I always had a lot of passion about prevention, teaching not only students, but also my patients. So I was always very close to this educating in the right way. So actually that was what got me here today to the education department, let's say. So currently, as I mentioned, I'm an education manager. So we help spreading the prevention and the knowledge about oral care, creating good habits, training not only dental professionals, but we also train dental students, consumers, pharmacists here in the region.
Well, that's really great. That's amazing that you have all of this expertise and knowledge about oral hygiene. Well, we're going to be talking about like some questions that I notice patients, they go through, let's say. Like, for example, we have many expecting mothers that are experiencing high sensitivity in their teeth and gums. So what's the changes that happen during this period of time, like during their pregnancy, and what should be done about it?
So during pregnancy, the future moms, they do have some changes occurring in their mouth.
Yes.
So it's quite normal to have, for example, what we call it pregnancy gingivitis. So your body, I mean, the body of the future moms, it's very sensitive. The hormones are changing. So the body becomes more sensitive to anything and it reacts in a different way. Meaning that, for example, if the future mom is not brushing properly, and if there is some bacteria sitting on the gums, it's pretty normal to the gums to react and to be very sensitive to that plaque. So experience some swelling, bleeding gums, inflammation, it can be quite normal during the pregnancy. This is one of the most common problems that can happen. Another, it can be, for example, during the first trimester, pregnant ladies, they often have this nauseous, vomiting. What we need to be aware of is definitely that the acid exposure can happen in the mouth, so it can lead to some tooth erosion. So of course it can damage the enamel and so on. This is another example. Often the habits of snacking, these cravings, it can lead to a
lot of cravings, like sweet food. We have savory as well, salty snacks. So I guess it affects the gums, right? It makes it more sensitive?
It affects actually the tooth itself. So it can become a high risk of cavities because the constant snacking and the changes of the pH, it can lead to the tooth become more, let's say, prone to develop cavities. So given this change that happened in the body of the future moms, we always, as a dental professionals, we always add some tips. For example, for the sensitive gums, using a soft brush head is very important.
I was about to ask you actually, like, because I see in supermarket, for example, there are different types of brushes. They're like the soft, medium, hard, and is it important to know like which type of brush that needs to be used? And is it just applicable on pregnant women, or it's also for us like as normal adults, kids, for example?
Definitely. It's for everyone, this advice. A
Oh,
soft
really? I did not
toothbrush.
know that.
Yes, I think is a common, people think that hard brushes, they actually, they are better, they clean better. But it's something that we need to keep in mind. Definitely is a hard toothbrush. It can actually damage the gums and damage the tooth with time. So I always do this example. While you're washing your car, you don't want to damage any painting of your car. So what do you use? Something soft, right?
Correct.
So why, if you think about it, in your mouth, in your teeth, in your gums, the plaque, the bacteria that is sitting there is soft. So we should just use something soft. That's it. It's simple as this. So same example as the car. You just need a soft toothbrush to clean your teeth and your gums.
That's a great example.
Yes, it's a great example, and I always bring this to my patients because this is how we can aware more people.
At what age we should introduce brushing the teeth to the kids? And should they use toothpaste with it or without it? So what do you think?
So for the kids, it's always a question from the parents. Definitely, they are always very concerned about it. So parents, they should be cleaning the baby's mouth every time they are actually breastfeeding. But brushing itself, they should start brushing as soon as the first tooth erupts, comes up.
Oh, okay.
And they can start using right away toothbrush. Okay, so what they need to keep in mind is definitely have use something very and extremely soft, because we want the baby to get used to it, to have a pleasant experience. So it's extremely important the right choice of the toothbrush. For example, in Curaprox, our toothbrushes, they have a different material, which makes it very, very gentle, and it gives you a pleasant experience because of the material. It's not nylon; it's a different type of bristles. You know, like bristles is what is made the brush itself. All right, so this is what you need to keep in mind, is always choosing something extremely soft so the baby can enjoy. And in terms of toothpaste, we can add as soon as they start brushing the teeth. Parents, they need to keep in mind that babies, they cannot spit out. So the amount of toothpaste is what do they need to look for. All right. So, you know, all of these commercials that we see in the TV.
I see them. They put like full of it. And I used to think that, yes, it should be like that. You know, the more, the better. But actually, the less, the better it is.
It's correct. So actually, a lot of people, they try to follow sometimes this kind of commercials. But we need to keep in mind that there is no need of using that amount of toothpaste, especially for babies, for kids. They don't, as I mentioned, they don't know how to spit. So using, for example, until the age 3, they should just use a smear like a rice grain size of a toothpaste. So very small amount. After 3, they can start using a pea size. Okay, so they can add a little bit more. This is something that they always need to be aware of. Okay, so like the amount of toothpaste. When it comes to the choice of the toothpaste, if it has fluoride, with non-fluoride. So this is a very also particular question. So some people, they prefer to go fluoride-free. And also, for example, in Curaprox, we offer fluoride-free toothpaste for baby and kids. For those who prefer to go with fluoride, because fluoride, it actually prevents against cavities, it protects the teeth. So it's important to have it on the toothpaste.
Then why would families opt to having a non-fluoride toothpaste?
So it's sometimes they just prefer to follow, let's say, a more holistic approach and to find and to choose a more healthy toothpaste. But for example, our toothpaste, they are also healthy. All right, our toothpaste, they don't have SLS, they don't have this nasties, let's say, in the toothpaste. So I would say, and answering your question about fluoride, the major dental associations, they still, the guidelines is still using a toothpaste for kids, adults, and so on, has a protection for the enamel. So we still advise to use between 1,000, 1,500 ppms of fluoride. This is the amount that you can actually see on the box when you buy a toothpaste.
So what about SLS and all of those things?
That's a very good question. So SLS is known by sodium lauryl sulfate. This is a very long name, but people, they actually don't know a lot about it. So it's mainly present in most of the toothpaste in the market. It has zero benefits for your health. So it's something that you should stay off while you're choosing your toothpaste. Yes. So I would say stick in mind 3 standards when it comes to choose the right toothpaste. First, having always something that can protect your teeth. So if you're okay with fluoride, you can go with a toothpaste with fluoride in it. Second, going for something with no SLS. For example, Curaprox, we always offer SLS free in our toothpaste. And why? So SLS is known by causing like dry mouth, ulcers, and irritates the oral cavity. So it's something that is just to add on that some brands, they add it just to cause foam. So this agent is actually present in shampoos, for example, detergents, that you have it in your kitchen. So there is no benefit of having in the toothpaste. So also another standard is definitely picking a toothpaste with no SLS. And the last one, I would say, always choose something with low abrasion. So a lot of toothpaste in the market, they also offer a very high abrasion level, meaning that they can cause, they are not enamel friendly, and then they can cause abrasion in your teeth. In the long term, it actually can create sensitivity. So always look for these 3 standards, let's say, when it comes to choose toothpaste.
It's very interesting, and I'll keep in mind next time. And I feel like we should all make sure that there is no SLS. Compound in our toothpaste. I have another question. So basically, I remember back when we were kids, brushing teeth is like a chore for us. Like it's something we're forced to do it, and our mom would be like, "Yalla, go brush your teeth," and and we would be like, "No, later on." So how can we make it more fun to children rather than making it as a chore? Like, yeah, you have to go brush your teeth and all.
So that's a very good question. And if you think about it, it's a hard task for the parents to start creating these healthy habits in the kids.
It is. I remember my mom used to suffer a lot with us on this.
Exactly, like me. So for me, the fun part was definitely eating the toothpaste, which is totally wrong to do, but I remember. So, and why am I saying this? Sometimes adding something that they look forward to, like adding a fun flavor, for example, in the toothpaste. Of course, parents, they need to supervise the brushing, okay? So until the age 6 and 7, this is important to mention, they try to convince the kids to go and brush their teeth and to make it a fun experience. Sometimes it's boring for the kids, yes, but adding some small things like a tasty toothpaste that they like it, that makes it fun, the brushing.
Yeah, like a cherry flavor.
Exactly. Strawberry, something that they like it, of course. Because if you add something that they don't like it, they don't like the taste, of course, they will not enjoy the experience. Also, having, for example, a colorful, friendly kid toothbrush. So it's something that you can think about it. Another tip that I can say is definitely putting a song, for example. Having a song with the time of 2 minutes, it makes it fun. So it can be like a challenge for the kids until the song finish. Let's brush our teeth together.
And how long is the best time to brush your teeth? Because some people say, 1 minute is enough. Some people say like 3-4 minutes. So what is the best time, duration to brush our teeth? And overall, let's talk about the the oral hygiene, like how many times in a day we should be doing that? What's the step-by-step process?
So we recommend normally 2 minutes, but as long as you can cover all the teeth, like normally it's around 2 minutes. So like 1 minute for the upper teeth, another minute for the bottom teeth. Of course, you might need extra time depending if you have anything that it requires more attention in your mouth. So, but the standard is definitely 2 minutes, twice a day. It should be part of the routine, morning and night time, preferably. Of course, if you can do one more, it's perfect. But actually, it's just enough 2 times a day for 2 minutes.
Let's talk about flossing and interdentals and all of those stuff. For example, flossing, should it be done before brushing the teeth or after? And also the interdental, it comes in different shapes and different sizes. So what is the recommended, like, for example, size? Which type, for example, of interdental brush that we should be using? And is it the same as flossing, or can we choose this or that? What do you think?
So I can be here speaking about interdental brushes for the rest of the day. Actually,
Really?
yes, it's one of my favorite topics. And I was when I actually graduated in dental hygiene, I was a big believer that only floss we can just use in terms
That's
of.
what I thought also, like,
Yes.
like I know flossing is very important and I do it, of course, on daily basis, but I did not know that we can also do interdental. Like, excuse my knowledge, Yani, I'm not an expert like you, but can we do, like, should it be done like both together, or which one, and which one is better and recommended?
Yeah, so I think people, they got used to the idea about flossing is the only way
Yes.
that actually they can clean between the teeth. But actually, there is this amazing tool that we call it interdental brush that
Okay.
helps, and it's way more acceptable for everyone in terms of cleaning between the teeth. Why? So floss, people, they always connect flossing or cleaning between like a boring moment, a very hard task. Is very, it's not acceptable. You know, like it's very difficult to convince a patient, a consumer, anyone to floss. Why? It's a very difficult technique to perform. And for you to do a perfect cleaning between the teeth with the floss, I can tell you it's not easy. Even me as a dental professional, I do struggle. If you want to perform 100% correctly, you know, like a very correctly technique. So, of course, I would suggest always interdental brush. And answering your question, there are different types of interdental brushes in the market, yes. And there is something that we need to keep in mind. It can be more easy to do, but we need to know exactly what is the right size that we have to use. Okay, because it's an amazing tool to clean between the teeth, and the studies, it's back up with science that interdental brushes, they actually can be more effective in terms of reducing the bleeding and cleaning between the teeth than floss. So that's why we advise interdental brushes. And interdental brushes, they are for everyone. All right.
Oh, okay.
Not for only people with gum disease or people that are using braces. So this is something that we also keep in mind, because people, they often connect, okay, I don't have spaces between my teeth,
True.
so I can only use floss. But it's not correct. So if I can give you my example, so I don't have big gaps between my teeth, but I do use interdental brushes. So we do have different sizes in the market. How can we make sure that we are using the right size? We always advise to check with the dentist, with the dental professional. For example, in Curaprox, we do have a special tool that helps us measuring the spaces and give you the exactly the correct size for each space. This is how we guarantee that you're not using something too small or something too big.
Is it normal for the gums to bleed during flossing? Because yani, that's what happens with everyone, and it happened with me also. So is it normal that the gums are bleeding during that?
So a sign of inflammation, bleeding, it's not normal, definitely.
Oh.
So sometimes when there is like the initial phase of some inflammation, gingivitis, It can be reverse, just using interdental brushes, for example. It's so if you're flossing or using interdental brushes for quite a while, of course, it's a sign that something is going on there. So you should check with your
run to the dentist.
Yes, correct. There is a sign of consistent inflammation. Something is wrong. It's not normal. So people often think, I think in the past, the people, they always think that bleeding gums is normal. It means that we are cleaning properly.
That's what I used to think, until I checked the information and my dentist was like, no, you're doing it wrong.
Yes, it's correct. So having bleeding gums, there's a sign of something is wrong there. And if it doesn't reverse after you brushing properly and using interdental brushes properly after 4 or 5 days or a little bit more, it's a sign that you should really check your dentist.
For young adults, products like BU, they focus on flavors and lifestyle appeal. So do you really think that it makes like a difference in motivating them? What's your input on this?
So yeah, in Curaprox, we do have the toothpaste that you just mentioned, BU. And why do we have that? So we understand that nowadays, it's teenagers, this Gen Z, it's all about like cool, fun, this follow the trends. So I think it's kind of like similar as the kids, adding something that they look forward to that can actually engage their compliance to brush.
Yeah, that will make them more motivated.
Exactly. So adding something like a tasty flavor, it will help them with the habit, with the consistency. So that's why with this BU, we try to follow the lifestyle, make it cool, make it fun, the brushing. So why not having a toothpaste with different flavors? So that's why we offer like apple, watermelon, grapefruit, so you can have all of these choices to keep encouraging the teenagers to keep a healthy lifestyle.
Now let's move to the next segment, which is a myth-busting segment. I'm going to be asking you questions.
Excited for this part.
It's actually my favorite part. Do we really need mouthwash? Or is it just something that is nice to have and add it at our counter?
This is hard to choose, to be honest. Straight away, of course, I would say it's false. We don't need. If you're healthy, it's more than enough just to do like brushing and interdental cleaning. That's it.
No flossing?
No, actually, interdental, it replaces flossing, all right? So you don't need to do flossing and interdental at the same time. So you just do one technique, actually, okay? So speaking about mouthwash, people, they often like to buy those ones that they are in the supermarket.
Yeah, they choose those intense flavors also. So I want to know, is it something that we need to keep at our sink or no need? We can just throw it away. Okay,
big no.
Throw it away.
It's a big no. A lot of those mouthwashes in the market, they have ingredients that they are not necessary, full of alcohol, and actually they can disrupt the good bacteria that you have in your mouth.
Okay.
Because you have bad bacteria, good bacteria, and using all of those formulas, it will actually eliminate all of the good bacteria. It can create an imbalance, so there is no need for that. Unless if the dentist or the dental hygiene, if you're under treatment after surgery, if they prescribe, if there's something that you need to use and it's prescribed by a professional. But I would say the ones that you see in the market, in the supermarket, just no.
Just toss it away.
Yes.
Okay, next question. Some people say soft brushes are, it does not clean very well. So what do you think? What's your intake on it?
Well, continue our podcast, right? And as I mentioned before, my takeaway for this is definitely no. So soft toothbrushes, they clean, they perform perfectly. Soft brushes, they are designed in a way that can embrace the tooth itself and the gum. So they can reach actually, if you compare to a hard brush that they cannot reach. Okay, so soft brushes and a very good quality of bristles is way more important than having something hard.
So is it true that you can't clean your teeth properly when you're having your braces on?
That's false,
okay.
Of course. So, of course, having braces on, it just doubles the effort of the teenager or of the adult that is wearing the braces. But we have tools for that. So they just need a little bit more time. Having braces on, it just requires to add a few more techniques and maybe a few more tools or specific tools. But it doesn't mean that you cannot clean properly. You can still clean properly. And nowadays we have, tools for everyone.
And for everything.
Exactly.
So another common thing is that does the tongue cleanse itself? Or do we need a tool or like a brush to brush it away?
It's false.
Okay.
So actually the tongue, it doesn't clean itself.
Oh.
So the tongue, it has actually a different structure and it actually retains a lot of bacteria, food debris and so on. And it actually can cause bad breath. So if we are not cleaning our tongue, definitely sometimes we can have a bad smell as well. Of course, there is also another reasons, but tongue and not cleaning the tongue, it can lead to halitosis. So using a specific tool is what we normally advise. We call it a tongue scraper that actually can help you cleaning from the back of the tongue until the front in a proper way without damaging it and causing any harm on the tongue.
And is it true that the bigger the brush is and the bigger the bristles are, is it true that it cleans the teeth more or not?
A big no, of course. So when it comes to choose the right toothbrush, you should always be looking for something small and dense. All right. So the more bristles, but the more compact they are, the better. And the smaller the head, the better. So having something a toothbrush head very big and with longer bristles, it can actually hurt and harm the gums. And with the big head, you might not be reaching all the areas of your mouth, your teeth. So having something small and just be more precise, it's better than having something big and try to, catch like 5 teeth at the same time. Okay, so this is totally wrong.
We used to think that it would, expedite the process of brushing our teeth more, but apparently, no, it's not.
Yes, it's correct. Yeah.
So we've heard about the golden rule of that the toothpaste should be the pea size. So is it correct or incorrect?
Well, it's a guideline. It's not a strict rule. Okay. So this is what the guidelines say is, for example, a pea size is advisable for kids after the age 3. Okay. And why is this? Like, we don't actually, if I will put it in this way, we actually just need a good toothbrush, all right? And
a soft toothbrush.
Yes, exactly. A very soft toothbrush. And the toothpaste, it's an add-on. There is some benefits, of course. But if I had to choose, of course, just a toothbrush, okay? But a toothpaste, it's important also to use if it's a healthy toothpaste, if there is no nasties in it. But I would say also always looking into the right amount that you're using in your toothpaste. So a pea size is recommended after the age 3. You can just add a little bit more as an adult. Below the age 3, just even smaller than the pea size. That's it. So this is the guideline.
Interesting. And finally, does the interdental brushes, does it create gaps between teeth?
Well, this
yes
is
or no?
Yes, no? I forgot. No, actually, no. Sorry,
does not create gaps.
Yes. So gaps are naturally present, they are naturally part of the anatomy of the teeth. Okay, so the teeth, they contact with each other, and they are actually filled by the gums. Okay, when we are talking about a healthy patient, a healthy gums, a healthy smile, so they are naturally there. So using interdental brushes, definitely, if you're using the right technique, the right size, it won't open any gaps between your teeth. It will just clean whatever that is stuck there.
Oh, that's great.
Yes.
That's amazing.
Have you tried it?
No, but I will try it. Definitely. I'm going to hit the supermarket and I'll try it and I'll let you know the feedback later on.
Once a day is more than enough to use interdental brushes. So with interdental brushes, you just need to do put it in and out in between the space once time. That's enough.
That's amazing.
Yes.
So if you could give us a piece of advice on our today's topic, like the oral hygiene, different types of toothbrush, toothpaste, and all of those stuff, the interdental as well. So what would be your piece of advice, and how how would we advise our patients to follow a proper way, a more sustainable way in terms of oral hygiene?
So, of course, I would definitely say consistency. All right. So, maintaining good habits is essential for a lifelong, healthy life. All right. So, we often forget about oral care, brushing the teeth, and probably it's always the last thing that we want to see is our dentist, our dental hygienist. But we need to keep in mind that if we stick by simple habits, and if we are consistent with brushing 2 times a day, cleaning between the teeth once a day, adding these small habits, it can give you a healthy life because you're preventing a lot of problems. So with a simple toothbrush and an interdental brush, you can prevent a lot. All right. So
That's
because you're
amazing.
removing everything that is in your mouth that is bad. So having these small, simple habits, it will give you a lifelong, a healthy life for sure.
That's amazing. This is something very important, and I totally agree with you. Of course, we reached to the last part of our lovely episode, and I would really like to thank you for joining us today, to giving us more insights about the proper way to maintain our oral hygiene, the step-by-step process, and it was really lovely having you here. And me myself, I learned a lot in this lovely talk of ours. Thank you for joining our talk today, and thanks to Angela also for sharing us these lovely insights and information. How can we reach out to you?
So my pleasure of being here and sharing all this knowledge. It's always super important for us spreading the right message, the right knowledge to everyone that is passionate. They want to know more about prevention and oral care. So if they want to know more and check our products as well, they can reach out to Curaprox Arabia Instagram. So just drop any questions there.
Well, that's great. We'll definitely do that. And of course, thanks for joining our talk for today. Subscribe to our channel so that we can get a sip of knowledge every now and then. And stay healthy and stay tuned for our next talk.